If you have two little dimples in your back, that's typically right where your sacroiliac joint is. And it's a long joint in the back. As you can see here, it runs all the way through here. That is your SI joint. They don't move much, just a few millimeters at a time, but they play that huge role in absorbing the shock between your upper body and your legs. And when they work well, you don't even notice they're there, but when they get stuck, inflamed, or they're moving too much, you definitely know they're there because you get that deep pain in your low back, buttocks, and even pain that sort of feels like sciatica. Here's something that a lot of people are not aware of, but SI joint dysfunction is fairly common. Some research suggests that between 15 and 30% of people with low back pain actually have pain that's coming directly from that SI joint. But here's a good twist. Many people have mild SI joint asymmetry and wear and tear just normally in their scans, and they never feel any pain at all. So just because you have some SI joint changes or dysfunction, it doesn't mean that you have to have symptoms forever, and that's great news. It's very easy to see why you can have some asymmetries because most people have a more dominant or more stable leg. Or if you were to jump, you would push off one leg more consistently than the other because it's stronger. So just think that those muscles in that hip, that glute, your hamstrings, your quads, those muscles are going to be more developed on that side, which can cause a little bit of a pull and a stress in that side of the SI joint more than the other. So that's why there could be some misalignments or issues one side more than the other. So how can the SI joint cause sciatica-like symptoms? Well, it's not like a herniated disc that can actually hit the nerve directly or a bulging disc or spondylolisthesis that can pinch the nerve in the foramen, but the SI joint can indirectly affect the sciatic nerve because when the SI joint becomes inflamed, it can become misaligned, inflamed, some swelling in the area, and it can cause pain that radiates down to the buttocks and the leg, sometimes all the way down to the toes. This pain travels along the branch of the nerves that connect to the sciatic nerve, so it can feel like sciatica. People with SI joint problems often feel a deep aching right at the base of their spine or immediately one side or the other of the spine. They typically have pain more so when they're sitting long or standing up from a chair. The pain can be there when they're rolling over in bed because of the stress that they're putting through the SI joints. When they're climbing stairs, getting in and out of a car, anything that causes the hips to twist and the pelvis to have a little bit of a torque in it. Sometimes numbness or tingling in the thigh, though that is less common than the sciatica symptoms. The tricky part to the SI joint pain, it can easily be mistaken for a disc issue, and that's why it's so important to test and treat right away so it doesn't develop further. The good news is SI joint problems are treatable and beatable, and here's what I like to tell people. You don't need injections or surgery for most people. So what do successful SI joint treatments look like? When I work with clients who have SI joint related issues, I want to focus on my three simple step approach. First, we balance, then we stabilize, then we get you functioning again. Those three steps, as you go through them, are addressing the main problems of SI joint issues. Number one is the inflammation that's caused from the problem. And you can use ice or heat, gentle stretches, but when you balance out the body, you're taking pressure off the SI joints, which will calm down the inflammation and actually reset the joint to its proper position. What happens is when you have pain, the body compensates for that pain. So you have imbalances throughout your body that cause extra tension in your body that cause the muscles around the SI joint to tighten down and hold things firm so no further damage or irritation occurs. When you balance out the imbalances in your body and you take that extra stress and tension off, the SI joint, the muscles around the SI joint, the glutes, the low back muscles can relax, which free up movement for that SI joint so that it resets the joint. And then once we get the body balanced, then we work to stabilize the glute muscles, the low back muscles, to hold that joint in a stable position and let it move those millimeters that they each move normally and naturally and not get aggravated further. We can also work on fixing daily habits. We can teach you how to move in such a way or do an activity in such a way that you're taking that stress away and working the side of your body that's looser, more comfortable, less restricted, so you don't keep on aggravating that problem over and over. People can see a huge difference in just a few weeks of the right treatment approach when they stick with the right plan and they stay committed to it. So if you do have sciatica that's being caused by your SI joint, please don't lose hope. As I said before, it's very treatable, beatable. You do not have to live with that pain forever. With the right plan of attack, consistency, and diligence on your part, you can get that joint moving pain-free and symptom-free again so that you can go back to living your life without pain, without problems, and without worrying about paying the price later. So if you'd like some step-by-step help, please comment SI in the comment section below, and myself or one of my advisors will get in touch with you and let you know what we need to do for the next step so that we can get you the relief that you deserve. I'm here to guide you every step of the way. Once again, my name is Dean Volk. I'm with Sciatica Relief Now, and I want you to take care and have an amazing day.